Margot, we do something called bedside report, which means at the end of my shift, I'll come in with the oncoming nurse and introduce her and discuss your plan of care. Does that sound okay?
Sure, that sounds great.
All right. If you're sleeping, we only wake you if you'd like us to.
That would be fine with me.
And we ask your family members to leave unless you consent for them to stay.
I would like my daughter to stay.
Okay. You can expect a staff member to come and check on you and make sure you're prepared for bedside report.
Okay.
And we'll be back in shortly.
Thank you.
You're welcome.
Hi, Miss Carly. It's Quinn. Shift change is coming up, and I was just wondering if you're experiencing any pain that I could report to your nurse.
No, my pain is much better.
Your pain is much better? Good. Okay, I see that you have all your possessions around you. Do you need to go to the bathroom or be repositioned at all?
No, I think I'm fine.
Okay. And before I leave, can I get you anything?
Maybe some fresh water, ice water.
Okay, you want some ice in it?
Please.
All right, I'll be right back with that.
Thank you.
Before we go in, Margot had a CAT scan of her chest early this morning, and it showed some abnormalities that she is aware of. Dr. Massey will be up later to discuss those results with her. Just know she's nervous.
Okay.
Margot, my shift is coming to a close and it's time for bedside report. This is your new nurse, Patty. She's a great nurse. I'm leaving you in very experienced hands. And this is Audrey, Margot's daughter.
Hi, nice to meet you both. I'm replacing Sandy and I'll be with you till 7 a.m.
We're going to start report now, so feel free to add any information or ask any questions. Margot Carley is a 56-year-old that came through the emergency department and admitted for pneumonia.
Okay, Margot, can you please state your full name and date of birth?
Sure, Margot Carley, 626 of 60.
Thank you.
Margot presented to the emergency department early this morning with difficulty breathing, cough, and chest pain. She had a room air oxygen saturation of 84%. She has a history of a recently treated pneumonia, and we are currently giving her IV antibiotics and IV steroids through a PICC line on her right side that was placed this morning after multiple IV attempts. She also has lactated ringers running at 125 an hour.
Okay. Margot, I'm just going to check your PICC line here. Yes, and this. And we have lactated ringers running at 125.
She was given a Norco for pain about 2 hours ago. How is your pain right now?
I would say it's about a 3. I'm feeling much more comfortable, though.
She's also been started on breathing treatments. She recently had a neb. Did you find that effective?
Much, much better. I was feeling really short of breath earlier, but the treatment really helped.
She does seem to be breathing better now, but I'm wondering when the doctor will be in so we can talk to him about her CT results.
Your hospitalist, Dr. Massey, will be in later this afternoon to discuss the results of that CT scan.
Okay, I'll be sure to stick around so I can ask him some questions.
Margot did have an x-ray and CT of her chest and is looking forward to discussing the results.
Okay. Dr. Massey's great. He does a good job at answering questions and will address your concerns while he's here. Once I'm done getting shift report, I'll check on the status of when he's able to get here.
Thank you.
I appreciate
Margot has a oxygen saturation of 93% on 3 liters today. We're titrating to 92.
Okay.
Her oxygen demands did increase while she was up. She's walked the hall twice and did well. She's tolerating her cardiac diet, although her appetite is poor. She had a BM this morning and is voiding fine.
Okay, how are her labs?
She does have a white count of 12, which indicates an infection. Other than that, her labs were fine. And she has a VTE score of 6. That's the risk for blood clot. She's got the compression sleeves and medication ordered for prevention.
Okay. I'm just going to be checking your SCVs here,
Okay.
Margot. Yep.
She's at a moderate fall risk with the yellow socks and wristband in place, and she's been using her call light appropriately and gets up well with one assist.
And the band, and we have the call light. Great.
That ends my shift report. Any questions, Patty?
No, thanks for a great handoff.
All right. Any questions, Margot, Audrey?
Not that I can think of.
I think I'm set.
All right.
Margot, you can expect to see me within an hour for your assessment, and then I'll check on you hourly through the night. Be sure to use your call light when you need to get up to use the bathroom or for any other needs you might have through the night.
Okay, sounds
Okay?
good.
Thank you. Okay, Margot, I'd like to update the board at this time. Is there any shift goals that we can add at this time for you while I'm with you?
Well, besides talking to Dr. Massey, I would like to get some rest this evening.
I think that's good. We should also add an incentives barometer as a reminder for her to use it 10 times an hour.
Times 10 an hour.
Okay, Margot, thank you for letting me take care of you today. Patty will take over now, and I'll be back in the morning.
Okay, great. It looks like your table is within reach and there's a clear path to the bathroom. So just be sure to use your call light when you need to get up to go to the bathroom or for anything else you might need.
Okay.
Thank you.
Thank you, girls.
Thanks, ladies.